There is a common affliction that comes with no warning and affects millions of individuals, particularly children. Whenever you enjoy spicy foods, travel to scenic places, or have a tussle with your stomach, this illness can sometimes be very troublesome. This infection forces you to urgently seek medical aid if it gets worse. Diarrhea is not severely lethal, but it can cause death if not treated with proper regime and care. The human body is a complex structure containing numerous organ systems working together to keep life going. Still, if any of those organs cease functioning temporarily or permanently, it will lead to an awful condition. The food we eat goes from mouth to stomach and is converted into a thick, creamy liquid chyme. The chyme, which contains degraded food particles, enters into long hollow tubes, the intestines, and then further absorption of food and water occurs according to our body's needs. In the large intestine, food waste is temporarily stored and then expelled as feces. Suppose any problem occurs and a person needs to go to the toilet urgently and excrete watery feces and lose a significant volume of water. Then, what will be the consequences? Let's move ahead and explore why and how diarrhea occurs and the symptoms that cause a person to lose vast amounts of water and dissolved salts through watery stools. What is diarrhea? Excreting stools or feces is a common thing that everyone does daily and regularly. But if there is discharge of stools containing excess water approximately 3 times a day or more, this condition is referred to as diarrhea. A person with diarrhea abnormally passes loose, semi-solid or fluid stools for at least 2 weeks. This is known as acute diarrhea or acute watery diarrhea. Severe dehydration results from diarrhea as excess water, essential electrolytes, and feces are frequently discharged from the body. Essential electrolytes include sodium, potassium, and magnesium. These electrolytes are crucial in transferring nerve impulses, muscle movements, and regulating pH levels in the body. Kidney failure and water level imbalances result if severe dehydration occurs. Generally, diarrhea does not have fatal consequences, and it gets better by following the proper regime. But it can get worse and eventually causes death if the proper amount of fluid intake is not maintained during infection. Usually, diarrhea is cured within a few days, but if it continues for longer, it may be due to another underlying illness, such as irritable bowel syndrome, or inflammatory bowel disease, such as Crohn's disease and ulcerative colitis. Diarrhea is also known as intestinal flu or stomach flu. Causes: every person who may be an adult, child, or a person suffering from a certain illness is at risk of catching this illness. Infections by viruses, bacteria, and other substances are the reason behind this. However, the most common cause of diarrhea in children is the rotavirus. Viral diarrhea in adults includes several norovirus species, astroviruses, and adenovirus. Certain bacteria can also cause diarrhea, such as species of Campylobacter, Salmonella, Shigella, and Escherichia coli. Bloody diarrhea, most common in the United States, is caused by a toxin known as Shiga toxin, produced by Escherichia coli. Certain parasites are also found to be the causative agent of diarrhea, such as Entamoeba histolytica, Cryptosporidium, Giardia, and Blastocystis species. Diarrhea, which is caused by microscopic pathogens, is called infectious diarrhea. Apart from pathogens, improper sanitation systems can also cause a shortage of clean water as feces dispose off into streams and other groundwater bodies, leading to severe contamination of drinking water. Malnutrition, such as zinc deficiency, is reported to cause several episodes of diarrhea in children dwelling in underdeveloped and developing countries. Other complexities like malabsorption were also found to be the causative reason behind diarrhea. Other diseases and conditions like gluten allergy, lactose intolerance, bile acid or bile salt malabsorption, hyperthyroidism, drinking alcohol for longer periods, excess of hormones like serotonin, microscopic colitis, and radiation therapy are also the reasons behind this. Certain medicines, like penicillin, laxatives, antacids, antibiotics, and anti-inflammatory drugs, are also reported to induce the loss of large quantity of water and stools from the body. Symptoms: symptoms include abdominal bloating and pain, nausea, urgent need to go to the toilet, fever of 38 degrees Celsius, weight loss, dark color of urine, headaches and faster heartbeat, watery or bloody stools, dizziness, droopy eyes and dry skin and mouth. Types of diarrhea: acute diarrhea is short-term diarrhea caused by the consumption of water contaminated with viruses, bacteria, or protozoa. Infectious diarrhea lasts a few days and improves with proper fluid intake and medicine. Chronic or persistent diarrhea lasts for a longer period of time, almost several weeks, and several conditions like irritable bowel syndrome and irritable bowel disease cause it. Certain parasites can also be the reason behind chronic diarrhea. Transmission. Diarrhea that spreads through microbial infections is most common and responsible for children's death in developing countries. Pathogens causing infectious diarrhea follow the fecal-oral route. It spreads due to poor sanitation and contamination of drinking water with infected feces. Diagnosis. There are numerous causes of diarrhea, so several ways exist to detect the exact reason behind diarrheal infections. Stool test. A stool test is approached to detect the infectious pathogen causing infectious diarrhea. A stool sample is taken in a sterile bag or bottle. It is then cultured on the mediums, and the results are analyzed. Blood test. Blood samples are collected and then tested for various conditions, like anemia, thyroid problems, vitamin deficiency, and electrolyte levels. Imaging tests. MRI or CT scan is used to observe any structural problems within organs. Fasting tests. With these tests, any food allergy or food intolerance, like lactose and gluten intolerance, can be easily detected. A fasting test helps to change the diet to cease diarrheal episodes. Colonoscopy. A colonoscope is a thin, flexible tube inserted in the rectum to detect structural abnormalities in the large intestine, such as tumors, ulcers, and sores. Sigmoidoscopy. A flexible tube known as a sigmoidoscope, when inserted in the large intestine, causes it to swell by blowing air into it, making it easier to observe the lining of the large intestine. Treatment. Treatment depends upon correctly diagnosing the actual cause of diarrhea. There are various remedies for treating diarrhea according to the real cause. Medications. Antidiarrheal agents, including antibiotics such as metronidazole, commonly known as Flagyl, are approached if bacteria or protozoa cause diarrhea. However, bacteria, such as Shigella, are continuously evolving and becoming resistant to antibiotics. Apart from antibiotics, Pepto-Bismol, racecatrol, loperamide, and diasmectite are a few antidiarrheal agents used if diarrhea is caused by abnormal bile acid absorption, chemotherapy or radiotherapy. Probiotics and other supplements. Probiotics are supplements with bacteria that promote good intestine health and are useful in combating diarrheal illnesses. Probiotic lactobacillus is reported to mitigate the symptoms of acute diarrhea. Intake of lactase is also a supportive approach to resolving the illnesses. It is an enzyme that is helpful for people suffering from diarrhea due to lactose intolerance. Symptoms of diarrhea caused by zinc deficiency can also be alleviated by taking zinc supplements. Fluids. As diarrhea is associated with the loss of a huge volume of fluids along with stools, taking a necessary quantity of fluids is beneficial in relieving the symptoms of diarrhea. Oral rehydration solution is sweet and salty water that helps restore the fluid volume in the body. ORS can be made at home by mixing 3 grams of salt and 18 grams of sugar in 1 liter of water. Diet. Consuming fiber-rich foods helps keep good health during diarrheal infection. Patients should abstain from eating fatty or fried foods and stick to the BRAT diet. BRAT stands for bananas, rice, applesauce, toast diet, strongly recommended for diarrheal patients. Preventive measures. Vaccinating yourself against rotavirus, especially children, is helpful in preventing diarrheal infections. 3 doses of Rototec are given to children at 2, 4, and 6 months. At the same time, 2 doses of Rotarix vaccines are administered to children at the age of 2 and 4 months. Maintaining hygiene by washing hands after or before using washrooms and public toilets, cooking and eating. Storing food at the right temperature and place is also effectively restricting the growth of pathogens that cause diarrhea. Always be careful with what you drink and eat. Drink plenty of boiled water as it is free of all germs that cause infections. Eat properly cooked meat and properly washed fruits. Always try to consume pasteurized milk. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.